I'm so sorry to be late. I just got out of what they call a lair. Are you familiar with something or someone called Killer Croc? Yeah, I've never seen something like that. I mean, I was prepared for, the worst, but I didn't think that it would be like that bad. I know. It's scary. They'd sedated him, with like what I presume was like the amount that would put down like 10 horses. But somehow he was still able to make threats, like under his breath, which by the way, he has not brushed his teeth in a long time. So I don't know if it's that or if it's the scarecrow's gases or something, but I am feeling a little bit lightheaded, so I just made sure that there would be extra security. There's nothing against you. I'm not judging you. I'm sure that some of you are here for, non-legitimate reasons. Besides, you don't look as scary as the characters I have met so far. May I ask your name? Okay. And is that your stage name or something? No. Okay. I'm just asking. I've not met anybody yet who has like a quote unquote normal name. But Poison Ivy's nice. Yeah. Do I enjoy nature? I do. I always make sure that I, don't step on the grass and whatnot. Yeah, I like to take good care. And no, I would never tear out a flower from the ground. Why would I do that? No. No. You care a lot about nature? Oh, that's good. Nice. Okay. So here's the thing. I was asked to come in today because apparently you had some sort of a run-in with someone called the Joker. Yeah. When I came here, I was expecting some sort of like fantastical drag show or something because everybody has these names and some of you look kind of, like interesting and cool. So I figured maybe this was just like, I don't know, some sort of like a joke and it's actually some sort of like, karaoke makeup event type thing, I'm not making fun. No, I love drag shows. I do. Anyway, I digress. So, yeah, you and the Joker had a run-in. Do you want to tell me about it? Okay, yes. I've heard of Harley. Mm-hmm. I believe she used to be a doctor here. Correct? Dr. Harley Quinn. Okay. Yeah, we'll call her Harley. That's okay. That's no problem. So, the Joker was insulting her? Okay, and you feel very protective towards her. Okay, well, that's good in a way. I mean, I wouldn't recommend violence, like, ever, but, I mean, I do kind of get it, Although, again, I wouldn't, like, but, I can see that, like, at the top of your forehead, you do have a little bit of a laceration there, so I would actually like to get that, sorted out. Your plants will fix it for you? What are you talking about? Okay. Well, I have been informed that you don't have any plants in your cell as of now. Because they say you talk to them a lot and then stuff happens. Yeah, but I'm sure we could bring you something, to make you feel a little bit better. I mean, we do care about your mental health in here. Yeah, so, I would just have to use my regular stuff. Although it is based on aloe vera. I didn't hurt the plant, no. No, it's something I bought at the pharmacist's office. Yeah. We could always just use water, but then I'd have to put like a band-aid on you. Yeah, make sure it doesn't get infected and whatnot. Okay. So no aloe. Good to know. Okay. Well, let's see. This is the water that I have here. Let me just apply this. Okay. So I'm just gonna have to touch your face. Okay. It might sting a little bit, I'm sorry. But this should disinfect the area. I'm just trying to help, okay? Okay. Yeah, I hope that feels okay. Let me just get a band-aid here. And I'm just gonna gently apply that. Okay, how does that feel? Okay? Okay, good. Right, so with that being done, I would also just like to kind of check to see if your eyes are working okay. I was told no bright lights, so I would just need you to follow my finger here, the one that's moving out. Don't move the head, okay? Just move your eyes. Perfect. Okay. Now the other finger. Up and down. Up and down to the side and back to the center. Now pick one of these fingers and follow. Only one. Okay. Perfect. Good. Nice. Now switch to the other. Very good. Okay. Just follow the movement. Very good. Alright. Okay, could you look up for me? To your side. And the other? Down. Okay. Perfect. I know, I'm not trying to insult your intelligence or anything. I know that you're all very smart and that a lot of you have been, doctors in the past or, chemists and whatnot. But, yeah, scientists, I know. It's just that I have to start out slow and kind of get to know everybody. I'm meeting somebody called the Hatter soon after you. I don't really know a lot about him. It's just that he has this fixation with Alice in Wonderland and stuff, Yeah, you've heard of him? Okay, can you give me like a rough idea of what to expect, kinda? Okay, right. Okay, that is perfect. Thank you so much. I never asked, and you don't have to talk to me about it, but you seem pretty sane for someone who is here. Do you want to maybe tell me why you're here? Maybe I can work something out that you don't have to stay here for, for as long. Oh, okay. So Yeah, I guess he didn't deserve that after accidentally treading on a dead leaf. Yeah, okay. Anything else? I see. Okay, well, yeah. Um, I know, yeah. When people buy trees for Christmas and whatnot, I know it's kind of a difficult subject, even for people who are not you. Um, because it's like the tree needs a long time to grow, and it kind of like brings up the question whether or not it's really ethical to do that or to buy just a fake tree. Yeah, no, I get it. I mean, I wouldn't really set the place ablaze, and, uh, you know, cause that much of a chaos. But, no, I get your point. It's like, it's kind of understandable. Okay, so let me just look through my files here that I had because I don't think there's anything else. Okay. So yeah, I just asked security to bring you back to your cell, and we'll talk again. Maybe there's something we can do because, like I said, you seem a little bit on the more sane side. Yeah, and good for you for sticking up for Harley. Yeah. Okay. Well, have a great day, and let the next person come in. Yeah. Goodbye. Hi there. Well, don't you look dashing? You are wearing a beautiful, um, is that blood? Yeah, okay. Yeah, no, this is great. This is really nice. Did you make this yourself? You consider yourself a great tailor? Oh, that's nice. That's nice. Look, you're the Hatter? The Mad Hatter. Okay. Right, and I have been told that you had a hat on that kind of restricted the blood flow to your head, and it also kind of was a little bit too much of a squeeze. Yeah, so I would actually like to just inspect you a little bit, if that's okay with you. And just, prod around at your skin a little bit just to see if it's still sore. Yeah, I mean, I can see that you're wearing a somewhat loose hat now, but I can also see that it's a little bit red. Yeah, so do you wear those hats for aesthetic purposes, or is there another reason? You had a rabbit under one of them. Okay. For an extended period of time, or so you did feed the rabbit? Okay, well that's nice. Okay, right. So, would you mind taking off the hat? Oh, you were okay. Get the security take the hat off. Perfect. Thank you. Right, I'm sure there's a reason why you have those cuffs on. So, yeah, I guess we gotta be a bit more careful with you. So, I hear you have this interest finding Alice. Do you want to tell me about that? Okay. So you captured these people, tell them to find Alice, and then you get rid of them. But doesn't that kind of like defeat the purpose of finding Alice? Or do you know that Alice doesn't exist? Okay. No, that's fine. I have to ask, It's important. Okay, so I'm gonna get a little closer, not too close, but if I could just kind of, I'm just gonna move your head. Okay, I'm just going to prod around your head here because I want to see if there is still some blood flow going on in there that would indicate that the hat was in fact not too tight, you know? Because otherwise we would have to maybe send you in for an operation, but so far I think, okay, let me just press here for a longer time and then let go. Okay, press here for a longer time, let go, and here as well, and here, okay, around here, and here, 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 okay, alright, interesting. So there is definitely enough blood on the surface. Let me just feel around here. Okay, well, you know, from what I can see here, it just looks like you've kind of roughly scraped the outside of the skin. But, since when have you been here, do you know? Only a few days. Okay, so maybe they didn't take into consideration that you are actually quite insane, and it has nothing to do with your hat being too tight. No, I'm talking to myself here. I'm just making, notes, and I'm just, I'm trying to piece together information that I do have. Have you been hanging out with the scarecrow? Not an actual scarecrow, I mean like the person. Okay, interesting. No, please no riddles. I've seen the Riddler today. I'd rather bite off my own leg than listen to another one of his riddles, so I'd rather you didn't. So, I'm just going to prod around at your skin here, okay? I'm going to be using a sharp and dull object. So, let me just poke you right here. Did that feel sharp or dull to you? Sharp, okay. What about here? Dull, Sharp, sharp, dull, sharp, dull, okay. Dull, sharp, 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 dull, sharp. Okay. Right. So, I can see that you've already applied, well, probably not you, probably some other doctor working here. They've applied some ointment, which by the smell, I think I recognize what that is. So I think you should be on the way to recovery pretty quickly, although I wouldn't even necessarily call it a recovery because it's only a little, it's not a big deal. I think you are just, slightly around the bend, as they'd say. And it's just what it is, Yeah, I wouldn't worry about it too much. Not that you are, but, Okay, I think we're done here. If you wanna... Okay. So, have a great day, and, I'm gonna be talking to my next client. So, yeah, goodbye. you must be Harley. Yeah, I've been told you wear wonderful makeup looks here. Yeah, I know. Yeah, I know you used to be a doctor here too. Yeah, well, let's hope that I don't, end up the same. Not that it's not nice here, it's just, I feel like you need to be a certain type of person. No, not in a bad way. I mean, you seem like someone who can, talk to the tough guys. I just write in my notepad and I make notes. And I will definitely be booking an appointment with my therapist after this. So anyway, for you I just have a general little checkup. So is there anything you want to tell me or anything that's been going on? I know that Poison Ivy has been defending you greatly. She's a good kid. Yeah, I figured. So you get along very well with her. That's fantastic. Anybody else here? No? Okay. Okay. No need to shout. It's okay. Let's change the subject. You are here for what exact reason, if you don't mind telling me? Right, okay. Yeah, so you're a very devoted person and you take your job seriously. Well, that's lovely. I think that's great. I think some of you are here for the wrong reasons. I think it would be probably maybe a bit better if you were to, channel that energy into something slightly more positive, rather than causing havoc. Maybe you could, do some good, like lock away the really bad guys, I don't know if you're familiar with somebody called Catwoman. Yeah, kind of like an anti-hero kind of deal. Maybe you could get that kind of thing going. I mean, I'm not going to micromanage what you do here. But, that might be an idea, So, yeah, you've been doing a whole lot of staring at me, which is great to hold a conversation and, like, keep the eyes, like, directly pointed at the person. But it is freaking me out a tiny bit. So, yeah, I know that's very funny. But, could you focus on this pencil? Can you focus on that? Yeah, just don't move the head. No, don't move the head, just the eyes. Yeah, great. And then just focus on the tip of the pencil. Okay, so you can actually, that's nice. Okay. I have some things with me where I'd like to just test your sense of smell and taste, if that's okay. Yeah, just keep following. Keep following without moving the head. Perfect. Okay. Yeah, center. Okay. Focus on the center of my face. Right. If you focus at the center of my face here, if I move my finger down here, can you see that? Okay, what about here? Here. And here. Perfect. Okay. Would you do me a favor? Could you identify these smells for me? I've got these little round orbs here. What does this smell like to you? Pineapple, good. What about this one here? Coffee. And this one, strawberry. Good. Let's do one more. Cinnamon. Yeah. Okay. No, I don't have anything that smells like fish. I've been told that you don't like fish, so I didn't want to anger you in any way. So, okay, so next up, I just got these little papers in here that have like a little taste to them. So if you just want to like dab this on your tongue. Got 3 of these. What does that taste like to you? Coconut. Okay, good. What about this? Apple. Okay, very good. And let's pick a third. What about this one? Lime. Okay, perfect. So that seems to be just great. Right. So, can you hear this? Okay. Now, if you would close your eyes for me, I'm going to be making these noises here around your ears, and one hand is going to stop making noises, okay? And I would need you to tell me which hand it was that stopped making noises to you, okay? Okay. Perfect. Let's do that again. Which one stopped? The right one. Good. Okay. One more time. The left stopped. Okay. Perfect. If you could just move your head slightly, I'd like to have a look here. Yeah. I'm so sorry to say this. I don't want to sound too invasive or anything. Your skin is so soft. What do you use here? Oh, something Poison Ivy did for you? Okay, well that's perfect. You know, I feel like you two would be a really good team, you know? Yeah. You know, I'm sure we'll figure something out for you. Okay. So, I have that written down. Okay. And we're going to be testing your blood as well, but then I'll have to ask you to go to the room next door. There's a lot more security in there because it's got like, you know, stuff to take blood, which is a bit spiky sometimes, so we want to be, you know, careful that we don't endanger ourselves. So. Okay, so who else do we have on the list here? Can you tell me anything about the Calendar Man? Boring. Okay. The Penguin. Boring. Okay. Let's see. Victor Zsasz. Fun. Okay. Right. Okay. Yeah, we'll figure something out for you, don't you worry. Okay. No. Overall, I'd say so far you look in pretty good health. I mean, like I said, we're gonna get the blood tested, but other than that, I don't see anything wrong. Except for, you know, your mental state has to be kind of monitored a bit. But I'm sure you knew that already since you are a very smart individual. So, yeah, and my advice would just to be, you know, ignore what the Joker has to say about you. He's just trying to get under your skin, you know, literally and maybe also figuratively. I'm not quite sure. Haven't talked to him yet, and I also don't think that he's on my list for today. But maybe eventually, so. I hope you have a wonderful rest of your day, okay? And I will see you again soon. Have a great day. Okay. Bye. appointment for myself, 4 p.m.